Hello, everybody. We begin Chapter 5 in our Delivering Healthcare in America textbook for our U.S. Healthcare Systems course. This chapter is titled Medical Technology. If you take a look, the objectives are really pretty interesting when you start to think about this. The role of medical technology in healthcare delivery. Your textbook has a great chart on page 178, and it talks extensively about the different types of technologies and what they do. Growing application of information technology and informatics. This sometimes freaks people out based off of the sharing of information, but also how it's used for a variety of different reasons. The aspect of telemedicine and telehealth. This is something that is really useful when we talk about across the nation or even internationally. And then the factors driving innovation, dissemination, and utilization of technology. These are some really important things when we start to think about how we can really start to look at health on that public or really global public view. And then the rest of them are the government's role in the technology diffusion, where the money comes from, how it goes, and how that information is shared. The domestic and global impact of technology, the directions of health technology assessment, who's driving the quality control and the usefulness of this, and then the status of medical technology under healthcare reform. This is something that's really very interesting. Who's paying for, who's supporting, and what is exactly going on with our healthcare reform. As we know, on a day-to-day basis, we get more and more information about what are the changes and what are some expectations. So as we begin in most of the areas of life, and if we look at the way we function, technology has been what you would consider a lifesaver. Very interesting. We've grown, we've developed new programming, we've developed new ways of doing things. And one of the things that we talk about in the medical field is the fact that it has literally reduced complications in certain processes for medical needs and disability. Less and less surgical injuries, less and less problems. If you take a look, one of the things in that table 5.1 I talked about is that one of the technologies is about diagnostics, what we're able to now see, which we weren't able to see before, and we would sort of guess. The things about survival and how are we able to get some of those information back and forth. So back in the day, blood transfusion was something that was really what we would consider innovative or state of the art. And now we have all sorts of organs and different types of survival mechanisms, all the way down to teaching people CPR and making it so that it's accessible for just hands only without even breathing. The way in which we manage chronic illnesses has become incredible. We have people who have cardiovascular disease for years and years and years while still maintaining a fair quality of life. Because of that, some of the things that I wish I could see more of, and that's because of my exercise science background, are those prevention things, the problems and ways in which we prevent some illnesses or diseases from ever onsetting. Prosthetics, if you are watching the Olympics right now, or you'll be able to watch the Paralympics in a week or so, that's going to be really exciting, some of the technology that we've done there and what's happening. And then, of course, the facilities and systems managements, where we're collecting information. We've decreased the amount of people who get the wrong medicine or too much medicine of certain types because of our shared prescription process. So some of those things are really interesting and really growing. When you get to all of the technology, though, what actually happens is that customers have expectations that are raised. Very similar to you. When you call somebody, you call your friend, you want them to immediately answer, and you can't understand why they don't. They have a cell phone. Why would you have a cell phone? The same thing sort of works for the customers when it comes to medical care. There's so much information out there. It's all you have to do is look on the internet, Google it, find something that's going on. So there's really some information overload and some things that maybe we have expectations that are unrealistic. I'm curious to hear some of you guys on the discussion boards this week about how you've seen patients literally become completely unrealistic about that. Technology assessment is a growing activity. So more and more, back in the day when I did cardiac rehab, we literally tested pacemakers through phone lines. And now the things that people are doing, I mean, I don't have to have a colostomy anymore. No, I don't have to have a colonoscopy. I can literally swallow a camera and pass it and they look. As we also take a look, then some of the actual ethical concerns grow when we have some of these things happening. We a long time ago tried to figure out what we did with in vitro fertilization, and that seems to be just this minor, not even a big deal thought now compared to some of the items and some of the things that we can do with technology. So from that standpoint, keeping in mind that medical technology is anything that can improve the health and any type of operations around health and physical well-being. When we start to take a look at this, we would consider that we have subdisciplines. So of medicine, we have the core sciences, the core knowledge where it comes from chemistry, it comes from physics. And so in those areas, that's where we're talking about how innovation is happening. When we begin looking at physics, we can understand some of the new prosthetics. When we take a look at some of the new medicines, pharmacology is all about chemistry. So from those things, that's where we're getting new information. We have this thing called nanomedicine, and it's in its infancy, and that sort of made me chuckle when we think of nanomedicine in its infancy. But this is where we're literally taking and manipulating materials at the atomic or molecular level. I've attached to this link another link for a TED Talk, which is amazing, things that you want to take a look at and see some of the latest stuff that we're doing in the world of medicine. When we also get here, we have to address the information technology. I touched on it a little bit where we're sharing documentation of pharmaceuticals and what types of prescriptions people are taking, and we're having less and less errors with people getting multiple prescriptions, too many narcotics, and or maybe the wrong dosage and such. So that's one way. The other way in which we're doing medical technology is where we're doing medical record keeping and those types of things, which are very helpful. Because again, it's shared. The problem is that some people, again, back to that ethics and moral use of that information, many people are very scared. I have a good friend who just complained to me today that her doctor actually asked, she just got a new primary physician, and the primary physician actually asked, do you have a gun in your home? And she was highly offended by that because what does that matter? Why is that any of your business? The doctor also asked, what is your sexuality? And she again thought that that shouldn't have to go on a medical record, that that should actually be something that's spoken about in the physician's office. So some interesting things that are going on with that and how we consider those things. What has to happen and who gets this information is probably concerning because, back in the day, we would do longitudinal studies or we would take certain groups and we would assess and test and we would do a scientific study. Today, we're taking data banks and we're trying to sort of tease out some information and where that goes. And so based off of this, we might say that the questions that my friend just had to answer, 92% of the people who have a gun in their home actually hurt somebody or were hurt by violence. And so that's a really sort of take a step back, take a deep breath, and start to think about how will that information be used in the future. So very important. The other thing is that when it talks about it requires the use of IT, the use of information technology means that probably you've been to the doctor and they literally are carrying around, some sort of tablet that they're keeping all the information on, which means that somewhere that data is out like in a cloud probably. So where is that at? At the same time, though, there's less risk for error. I would be very concerned about that because I've seen lots of, and maybe you guys have too. So again, I'd like for you to chime in on this, but I've seen where we have data entry errors that are so common. So I fill out something on a piece of paper, somebody in the office types it in, somebody else types something else in, and instead of it sort of being this one stop shopping, many people are adding to it, and it may or may not be correct. There are some risks to that, despite the fact that here our textbook is talking about the efficiency, the accuracy, and the reliability. I think that's really important to note based on how it's used. So the electronic healthcare systems, the same exact thing that we're talking about previously. There are benefits and drawbacks in the way in which it's done and the expense at which it's considered. The confidentiality is another big deal, and the financial incentives. Physicians' offices are getting financial incentives from different big tech companies, which are sharing that information. What is my sexuality? What is my gender? And do I have a gun in my house? So big concerns around that. But however, we have now the internet, the e-health, m-health, and e-therapy. And so some of these things are really interesting. There's an actual, paid TV special about a therapist who literally Skyped in with their patients and talked about what was going on. And so it's kind of a comical thing where we think, really? You're getting medical care? Or I've seen where somebody says, look at this rash, and they're showing their camera on to a physician that's someplace else and not near them, and that person is giving them some medical advice. And so I don't know, is that interesting or is that scary? Very important to start to think about that because it's going to grow and grow and grow. And then that goes along back with the telemedicine versus the telehealth, right? Telemedicine or distance medicine is where we're using certain technology. What is your heart rate? What is your blood pressure? How are you feeling? And there's some really cool technologies that go along with that versus telehealth, which is starting to use a bunch of different caregivers and different things that go on. One of the things that I want to point out to you is that telemedicine can either be synchronous or asynchronous. And so for you and I, you know that because you're taking a distance learning class. Synchronous means you and I are on the screen at the same time and we're watching, and asynchronous means I'm not there. Tele-ICU is a scary thing because maybe we have the doctors who have the higher level training, the bigger trauma training, they're at one hospital, and we have somebody who's not as highly trained at another hospital, and they're sort of screening in and seeing what happens. This isn't new. This has been happening over radios and walkie-talkies for years as it goes to ambulance, right? So maybe it's not the ICU, but we've had in critical care where somebody has had a trauma, they're in a car accident, they're wherever, and the paramedic is getting notes or tips or directions from a doctor in a hospital saying, okay, do this, do this, do this. And now maybe with a visual, it will improve or maybe it won't. It's very interesting to think about that. So take a look at what's driving innovation. Pretty much the same thing that's driving innovation all over the place is also driving innovation in medicine. One of the things that I think is really important to keep in mind is that competition always drives innovation. And the other thing that's huge in our world of medical care is the actual financing and payment. How are people earning their salaries and getting paid for the work that they're doing? And more importantly, how are people paying for it? And is there a way that we can better provide more equitable and fair medical treatment for the everybody across the board? Again, government's role. How are we pressing forward and making sure that technology is becoming the best of the best and that we have access to good things? There are lots of stories and you can do some research, and this might be a fun research topic for you to look at, but let's take a look at some of the medications. Let's look at pharmacology and see how we've developed some great medication to treat certain things. One drug specifically for obesity. We've actually had this drug for obesity, and we find that it works and it depletes hunger and also helps fat cells. And at the same time, though, it brings down cholesterol and helps control diabetes. And those are side effects. And for the first time, right, like I'm healthy, good.